Well, according to experts, LGBTQ youth in our community, they're at higher risk for mental health conditions, especially depression, thoughts of suicide, anxiety disorders. The Buckeye Ranch Initiative, I wish someone would have told me, is trying to combat that. NBC4's Hattie Hawks spoke with experts and a woman channeling her personal experience into hope for young people going through the same thing.
I knew that I was different from childhood.
But for Rhonda, sharing her differences with her deeply religious family would prove to be difficult as she struggled with being gay herself.
I knew what they believed, and I understood it because I grew up with that. So I bought into all of that for a long time.
Rhonda finally told her parents, but it would take years for them to acknowledge it.
They sort of accepted the fact that I had a partner and a child, but not fully. I knew it wasn't full.
A lack of support in the home, a struggle many in the LGBTQ community face, further complicating their depression and anxiety, says Dr. Patricia Gentile, a psychiatrist with the Buckeye Ranch.
Fit with the boys, they don't fit with the girls. They don't live up to the ideal that their parents wanted them to be.
According to a study done by the Trevor Project, 40% of LGBTQ respondents between ages 13 and 24 seriously tried to kill themselves. For transgender and non-binary youth, it's 50%.
Another factor is the discrimination and harassment that they receive.
From that same study, 93% of respondents say that they've been harassed or assaulted, which makes parental support even more important.
When you don't have it from your core, your family, the people that you've come from, it's huge. I mean, it really impacts your ability to feel like I'm okay.
It's an experience that shaped Rhonda into who she is today, an in-home clinician with the Buckeye Ranch, working with LGBTQ youth.
To me, they have a degree of strength that I didn't possess.
But still, she sees how hard it is, and as a mom to a transgender son, she's experienced the other side of the coin.
I have to be willing to learn from what they're teaching me. So that's true for me with the children in my life, in my families, and the children I work with.
Dr. Gentile says youth should practice coming out to their parents and talk to a professional for support. When it comes to people who are transgender, she says that it's good to ask what pronouns they prefer. It shows that you care. For more on the I Wish Someone Would Have Told Me initiative, head to this story at NBC4i.com. Local for you, Hattie Hawks, NBC4.